Well, good morning, world. This is Dr. Rico Short, and I just want to let you guys know about what we do as an endodontist. And sometimes root canals may not work out. We know statistically 80% of root canals are done by the general dentist. So sometimes as endodontists, we only be able to get our hands on about 20% of the cases. So what happens when the root canal doesn't work out? The patient has an option. They can take the tooth out and get an implant, or they can come and see us as a root canal specialist to get a retreatment. So we have a patient here. She was able to experience that. She had quite a few root canals done, and they just did not work out in a very short period of time, and she did not want to lose her teeth. So her dentist, I believe, sent her to me so we can evaluate it, and we had to do quite a bit of work. So she'll kind of tell you her part of the story.
I had 6 root canals done, and over the course of, I got them all done in 2014, and by the end of that year I was in pain. It would happen once every couple of months. Another one of them would get infected, and so I was taking antibiotics a lot, which I hated doing.
How long were you taking the antibiotics for, roughly, you think?
It would happen, I would say it happened once every 3 months that I would get an infection.
Oh, wow.
And so I was taking a full course of antibiotics every 3 months, and it would jump around. I would have one over here, and then I would have one over here. These ones up top were especially bad. That happened more than once. I was in Guatemala once when I started getting an infection, and luckily they don't require prescriptions for oral antibiotics for your mouth in Guatemala. So I was able to walk into a pharmacy and just get some, which was lucky. So yeah, it was such a relief to come here and have all of them redone. And now it's been a year and a half since we started, 6 months since we finished up the last one, and it's so nice to not, because you get edgy after a while, you know, when it's happening so frequently and the infection is coming back, and you know that the pain is going to come back. You start looking at your watch, counting down the days on the calendar, and wondering when it's going to happen. And it's been such a relief. It's been
so prior to that, have you ever heard of an endodontist before?
Yeah, I'd heard of one. I just didn't think that I necessarily needed to come to one, because I thought my dentist was able to do
everything.
Right, exactly.
Right, okay.
Exactly.
Okay, awesome. Well, hey, you know, we really appreciate you sharing your story, because there's a lot of people out there that have similar situations, similar stories, and sometimes they don't know what to do, and they're on antibiotics for months at a time, and we know the antibiotics long term does not, you know, do your system well.
Right.
It can actually create some other medical issues as well, make you resistant to more infection as well. So fortunately, we're able to get you off that treadmill of antibiotics and get the right treatment, because once we take care of the tooth the proper way, the body knows how to heal itself. And that's the beauty of the body, you know, that once you take care of the source of the infection, it knows to heal itself, and that's what we try to do. So we really appreciate you sharing testimony with the world, and just
I really appreciate you guys.
Thank you very much.
Stopping the pain.
Yeah, thank you very much. We appreciate it. So I'm just gonna kind of just show you a little glance on her x-rays there, and you'll be able to kind of see how where we started here. So this was the case where the root canals were done, and she had quite a bit of infection there on 30 and 31, and that was back in March 2017, and she came back today for a 6-month, well, a year and a half recall. You can see all the bone is filled in quite nicely. So just kind of put them side by side here. So you're talking about this area here compared to, if I can bring this up, so you can see the amount of healing that happened really in a relatively short period of time. A lot of dentists would have probably recommended extracting these teeth because the root canal looked pretty good. They thought it might have been cracked. So you go from a dark area here, and it all looking great, and that's, like I say, like a year and some change, and that's on 30 and 31. So those are 2 of them, and then we had to retreat top teeth 13, 14, and 15 have big areas of infection there, and we did a follow-up today, and you can see the amount of healing that has taken place here, this dark area here, and this big area of infection here has healed up quite a bit as well. and we saw her back on a lower tooth. That was the tooth before we worked on it. Had a dark area of infection here, and we brought her back today to check on that same tooth, and so we can see after the retreatment that area is healing up quite nicely. So it was actually 6 retreatments that we were able to do on her, and fortunately she's doing well with all 6 teeth, and hopefully she can keep these teeth forever. So that's our goal as an endodontist. Fingers crossed, right? So thank you guys very much, and if you don't know what's going on with your tooth, you know, make sure you see an endodontist in your area. We are the specialists at saving teeth. Thank you.